are, another episode, Renee. Oh boy. This is gonna be a good one, so everybody hang on.
Buckle in. We're starting in talking about what's going to happen in 2025. I'm excited to be here. This is going to be
How did we
exciting
get
conversation.
to 2025? I can't believe it's 2025.
I can't believe we're on episode 74. Who'd have ever thought that was going to
I
happen?
I had no idea.
I
I
know
had
you
no
weren't going to be a
idea this was going to
podcaster.
extend. I wasn't going to podcast ever, and here we
Here you
are,
are.
still rolling along, doing the podcast thing. So
Yep. So, hey, through the holidays, I saw this really cool post about you and your family. It was this ribbon cutting, and I
that's
got a little
right.
confused because that part, I understand that part, but I think it was a ribbon cutting for a grain bin, and I need some more information. So, I thought our listeners who may not understand ribbon cuttings for grain bins might need to
Right.
hear a little bit more about it too. So, tell me about the farm. That looked cool. I mean, it was really fun to see all your family together. So, I know it's a big deal, but tell us how that all happens. I mean, how is that like? It's a huge project, but like explain to those of us that aren't farmers why that's such a big deal.
Well, we'll clarify. This wasn't just a grain bin. This is an entire grain drying system. So
Oh,
it's
okay.
actually
See,
a
right
grain
there. I don't even know.
dryer that feeds into a large holding bin. And so we did have those built new this past year, which was a huge investment.
Oh yeah, yeah,
And
yeah.
so when we invest on the farm, we like to celebrate those things. And I do a lot of speaking about succession planning and how do you engage everyone
Yeah.
that's part of your farming operation. And none of us live on the farm, but we still want to instill in our kids who will someday be the heirs to the land that we want to keep in the family. We want to keep everyone connected. And so my nieces are in high school still, not necessarily active. I give them a hard time. They weren't in the tractor driving the grain cart this past fall, but we want to make sure everyone understands the importance of the land and the farm. And we see so many families that get in fights over the farmland or the one sibling that wants to keep farming, and people who live in the city or have moved away don't fully understand it. And so one way we keep it alive, even when we all couldn't get out there, trying to schedule everyone to get, my kids and my nieces and everybody at the farm at the same time. It just didn't work during the fall when we were working. So we were able to use some time. We were all together over the holidays, and we have a big sign that says Sukup Manufacturing and our farm, Hickory Grove Family Farm, on it. And we had a celebration. We did the ribbon cutting with my mom, and my mom's our primary investor on the farm. So she wanted to celebrate as well. She had a few words to say. I'm not going to repeat what she said about investing at 81 years of age in a grain bin drying system, but you know what? We had a family celebration. It worked out. And I encourage lots of farm families to figure out how to engage all individuals who will have say in the operations of that farm, because that's what succession planning is. It's planning ahead and making sure everyone understands the goals and the mission of that business. And that can be hard to do when you're disconnected from it, because we know the finances and the fluctuations in income and what happens on the farm with land values and equipment costs. It's really hard to make it these days. So the more that we're educating folks, the better off we are. So we did. We had a great ribbon cutting ceremony. I've got a video too, Renee. I haven't sent you the video yet. I'm going to post that
Ooh.
later.
All
You're going
right.
to see a video of it, and I'm writing an article right now about how important it is to engage everyone in celebrations when you have a multi-generational family farm.
See, now I knew it would make some more sense than a picture on Facebook. That's why I need you to talk about it today. Because
I
I was like
know.
looking at a ribbon cutting and I'm like, I think it's a grain bin. And I'm like, but I don't understand. So, see, that makes a lot more sense. Celebrating moving forward, generational success, all of that makes a lot of sense. So, that's a lot of
Now, had
fun. So,
we
congrats
had
on
we
that. That's a big
had we
deal.
been on the farm, we actually have fireworks, and so there's a fireworks display to
Oh,
come. We'll
well, of
do a
course.
fireworks display. We'll do drone footage. Like I have this whole thing in my head that we
Of
could have a
course.
drone up and we could do
Over the
fireworks
over
behind
the
it,
bin.
or we could
Yes.
shoot fireworks off the top. I don't know.
Oh,
That's all going to be in the future. You just wait. There's going to be
I
something
can't wait. But
huge
let's
that
hope
comes
that
from
there's
that.
rain so you don't accidentally set anything on fire
Well, that's
while we're
been the issue. All it was too dry all fall, so
right.
we
Too
couldn't
dry,
shoot
too dry.
fireworks. Yeah, so
All right. Well, cool. That's a really cool farmer story. So, like, I mean, that's not something I would ever know anything about. So, thanks for sharing. Okay, so today what we're going to do is we're going to talk about kind of a little wrap up on what 2024 looked like for our company, for Rural Policy Partners, and where we're headed for 2025. I don't know that everybody listening understands exactly what we do. Probably not. We don't understand sometimes, and we're all over the place. Jason much more so than I am because I'm a little more planted firmly where I need to stand most of the time. But we've been a lot of places, been a lot of cool things going on. So we're going to share that data when we get to that segment. And then we're going to talk about hot topics, what we think are going to be sort of the big topics of 2025 in the behavioral health world. We've seen some of the trends, feeling those wind blows. Sort of before we get to the end of today, we're going to chat about some hot topics. But to kick us off, so Jason, what in the world do we have coming up in this? What have we been doing as far as speaking, and where are we going with speaking? Kind of what's going on in our world in that realm. So you've been everywhere, man. So what we got coming up in 2025?
Well, it's we've really fallen into this great place where we get to go and speak at a lot of places. We've had some unique opportunities that allow us to be able to do that. And I mean, if we look in the rearview mirror, we were one of us or both of us were in 12 different states. I think I lost count midway through, Renee. I'll be
Right,
honest with you.
right.
But we were Kentucky, Maryland, Nebraska, Wisconsin, Illinois, Alabama, South Dakota, North Dakota, Indiana, Missouri. We did all of those things last year, and so we're looking
Yep.
ahead to kind of some of the ones that we know we want to go back to. It's a process though, right? We submit abstracts. We don't just get to go to conferences, right? We have to compete a lot of times to be able to go and speak and, tailor our message to what that conference is looking for. And so we know we're already going to a few next year. We know we're going to be in Nebraska for at least one conference. We know we're going to be up in North Dakota for at least one conference. We know we're going to go back to Illinois
Yeah,
and do at least one conference. I think next door in Indiana, it's pretty sure I'm going to be back there. So, I get excited by the travel, right? I'm at the point in my life where I like to travel. Sometimes I don't like the drive because it's a long drive to these rural areas. We were talking before this, like there's rural areas in warmer places. I know, but it's our niche, right? This is what we do. We talk about rural issues. We talk about
that's
rural
right.
behavioral health, and that means we don't go to the most populated areas in some of these small states. We're going out west to the panhandle of Nebraska, right? We're going to places where it matters, where people really want to learn and want to learn different ways to move forward.
Yeah, and when this recording comes out the weekend prior to it, we've done a conference with SARL, which is
Right.
State Agricultural Rural Leaders, and so it's legislators specifically for rural agriculture, but it happened to be in Des Moines. And so
Yeah.
our good friend Annette Sweeney, Senator Annette Sweeney, I should call her. I've known her as Sweeney forever, but Senator Annette Sweeney invited us to come and to do a plenary on rural health and then behavioral health. And so that's another conference that sometimes we just take for granted that we're doing those things because they're right in our backyard. And we think, oh, but that was a big deal. We're going to be talking to some rural and bringing, we brought some solutions, focused solutions to what they can do to improve their health system. And when we get to hot topics in a minute, this will tie back to that conversation because in rural America, this is one of their most important issues is behavioral health, and connecting it is the big challenge. And so we'll talk more about that in the future. So,
I
well,
forgot all about that conference. I just went down and added that we need to talk
I,
about that because we're going
yeah,
to be talking with legislators
yeah,
in roundtable discussions from all over the country.
that's right.
And I see there's some folks from Canada on the list
Oh, wow.
that
That's
I
going to be
saw
cool.
the other day. And
Yeah.
so, literally, we're going to be talking to folks from all across North America. And I didn't even have that on my list of
Yeah.
things coming up. And so we do take for granted sometimes just the scope of the
Yep.
conversations that we're able to lead.
Well,
And
and
that's very
the other
humbling. It's
one,
very humbling sometimes because I think
yeah,
about the audiences that we're now getting in front of and talking
yeah.
with. And I never
Well, the
dreamed
other one
that.
what we forgot is this month, it's because it's virtual, is the one in Las Vegas. We didn't get to go in
Oh,
person, but we've got
right.
this Las Vegas conference this month, January, and we're on the virtual side of that. So just think of how many people, I mean, even though we don't get to be in Las Vegas, are going to see us and hear us and talk about what we're talking. The issues are critical to them, but they're in Vegas, and so we're going to be posting our picture of like where we've been. We have a speaker tracker where we use tractors, which I think is kind of cute, was highlighting all the spots across the country where we've been speaking. And I know another place you hope to be in 2025 is also Anchorage, Alaska. And I know we're going to put in for that one. And if we haven't
We are.
already,
We
so
have.
Alaska, because we have not been to Alaska and are very excited because the National Association of Rural Mental Health is headed to Anchorage. And we have been with them now for the past 2 or 3 years as ongoing speakers for them. And so hope I mean, they have to choose us, but we were hoping to be
Right.
selected to be able to go back. And this one's in Alaska. So when we're talking about kind of where we're headed, it's kind of all over the place. And so that map is sort of getting to explode. And it's a huge honor. And it's such a
Right.
responsibility to be able to talk about these important issues in a lot of places. And, for so long, you and I spoke together, and it was just kind of here around Iowa, and we did all of the local things. And for us to now be able to say, kind of coast to coast, we've been
Yep.
invited and included. It's just a really cool situation because the other spot, remember at the beginning of last year, you were in Idaho, and so we're
Right.
spreading out. We don't have now. We don't always get to go to the warm places like we've talked about. I mean, come on, one day we've got to hit Hawaii, and we truly need to hit like
I know.
Southern California and Vegas in person. I mean, those are much warmer,
Right.
and we'll get there. But right now, it's like it's really cool to just see every year. It just the circle gets a little bit bigger. So I'm excited. What we don't even know may happen in 2025 that not on our radar today, but that doesn't mean
Right.
we won't end up in cool places by the end of the year. So that's pretty cool. So on that topic, we have a lot of speaking topics that we talk about. So let's talk about some of those things that when we go out and speak, what do we talk about? We have a really specific niche, but we're starting to really dial it in because we've really found the crux of the challenges in rural America. So where are we landing in that space?
Well, I think the themes that we're most often asked about is really healthcare integration across the board with behavioral health. And so whether we're talking about primary care, what happens in emergency departments, it's really that interconnectivity in rural communities between their hospital, primary care, and the behavioral health system, and how are we bringing all of those parts and pieces together, right? And so
Mhm.
we're there to help with strategic planning, with developing clinical pathways to move people through a system of care. We're there to help identify what is the system of care, because you'd be shocked when we go into a state, we ask, well, what are the levels of care that exist here? And a lot of times in small rural communities, people don't know what all the parts and pieces of the system are. And sometimes they're not available close, but sometimes they're more available than people know they are. And it's just building that all together. We look at strategies for how do you stack those services once people, figure out what they are, get comfortable with doing things differently. We talked about those non-traditional partnerships of sometimes there's more resources than we think there are. Of course, we spend a lot of time in the advocacy and public policy development space, talking with legislators, talking with departments who are trying to work with legislators, both from state levels, county levels, all across the board. And remember, don't forget, all these things happen within workplaces as well. And so we can do this work. We talk about big, macro level systems sometimes. We go to those micro level systems, like in your workplace. And how do you
Mhm.
design mental health awareness trainings, implement mental health awareness trainings? We do mental health awareness trainings and move the needle toward the next steps of better staff retention, being able to drive staff productivity.
Yeah. I mean, I really think about that advocacy and policy because here in the next week or two, in the state of Iowa and in many, many other countries, the legislature comes back into session, and education for those legislators is really critical. So if you're out there and you're listening and you are, a provider of services, you're somebody that's an advocate for services, now's the time. If you haven't already met your legislators last fall or had an opportunity to talk to them, the beginning of sessions are coming around, and this is when they need to understand your issues. And I always, in my past, I taught this to let for people who didn't understand how to advocate. But having been a legislator, you realize how much you do not know. And so I know for a lot of people that sounds crazy. Well, they're your congressman, they're your legislator. They
Mhm.
know. They don't know. They
They
haven't
don't
lived
know.
your life. They don't have your life experience, especially behavioral health. And so unless you've told them and help educate, they may not have any idea the struggles that you're facing. But here's the cool part about all those people. They run for office to help people. And so they're there to help you. So if you can help and teach and learn and show them a possible solution, a possible, like we were just talking about the Sorrel conference, it's all solution focused because those legislators are there because they want to make improvements in their rural communities. So we're going to bring them solutions, not cookie cutter solutions that don't work in rural communities, but hands on, easy solutions they can implement to make a difference. And that's really, really important for right now as we're kicking off across the country legislative sessions. So think about if you've got those issues, how do you talk to them and how do you work out? So then we also have some additional projects. So right now we've got a lot of things in the hopper. We're not sure. I don't think it's quite the season for signing contracts. So I'm guessing here in the next few weeks we're going to kind of have more things nailed down. But where do you see some of the projects? And they still kind of follow some themes that we've been doing. So
They
where do you
did.
see
I
that
mean,
headed?
as a small business, this is kind of, I always get a little anxious as a consultant this time of year because it's always about timing, right? That a whole bunch of our bigger contracts winded down here
Mhm.
October, in later in the year in 2024. And really we start fresh in 2025 with kind of a whole new slate of contracts that we've
Mhm.
lined up. And so we're right in the midst of getting everything finalized in all of those contracts. But, that's part of it. We wind down a project in Nebraska and then we start up a big project in Illinois. This is just kind of how it works. There's kind of that year to year transition that occurs, and then, a state will come back a year or two later. Hey, let's finish what we were doing, but it takes time. I almost forgot, like, we did some RFPs for some federal projects 4 months ago.
Mhm.
We'll be finding out about those in the first quarter of
Yeah.
2025 as
Yeah.
well. And so, we're always looking ahead to the horizon, but sometimes these large projects, large state projects, federal projects, it takes 6 to 12 months before we get an answer as to if we're going to do something or not.
Right.
It certainly isn't a nimble system that we
No.
find ourselves in a lot of the time. But, we have some exciting projects coming up. We have some exciting podcasts we're doing for other
Mhm.
entities that's going to be coming out that we're excited to partner with and kind of lend our name and credibility to. And so that's been really exciting. We've done that a couple of other times. And so, I think that's really unique and a great way to get the message out. I also know we're going to be doing some focus groups and work in
Mhm.
Illinois. And so that's going to be really exciting as we dive into some of those projects. And then we're waiting to hear on a whole bunch of other projects. And as we go through the system changes here in Iowa, I think that's going to help to clear out, what we can do to help, in our own local area as
That's
well.
right. Yep. So what's one thing that's really cool is we're starting to not just have the 3 month, 6 month, 9 month contracts, but some of
Yeah.
these newer ones, which are taking longer to finalize,
Yeah.
are multi-year contracts at the federal level,
Absolutely.
at the state levels. And so it really is all about just it's that whole sowing and reaping. You're a farmer, you
Yep.
got it.
I got.
And we've put a lot of effort into the speaking and the building of relationships, and we're starting to see some fruit on that. Because there's other days where if you sit back and go, man, if all of these come through, we're going to be slammed. And so it's
Right.
kind of we have nothing to do, but if everything
Right.
happens, oh my gosh. And so you're trying to balance both of those at the same time. Like, should we apply for more? Because we can't probably do more, but yet we don't have enough. And such is the world of consulting. So I've been on that train a whole lot longer than Jason has. So he's still learning that one. So all right, so we've got some data points for you here for 2024. We've crossed the lines. We've got thousands of listeners, Jason. Can you believe we've had thousands and thousands of listeners at this point on our podcast? And that is just crazy. Not only did I not think we would do this maybe this long, but also didn't realize we'd have a following. So that's pretty cool. And so we also mentioned, Jason said we've been in like 12 different states this year for speaking engagements. And those are just the ones we remember. Could be more than that, but we'll put up our map again. So
You
if you
make it
haven't
sound like
seen,
we don't remember where we've been. We remember. It's just it gets
well, we know
overwhelming
where
after
we've
a bit.
been, but we don't always keep tallies the way we should,
Yeah.
probably. So we'd have
Yeah.
to like go all the way through the calendar and delineate it. We've released 73 podcasts by the end of 2024. Wow. And they're on every platform you'd listen to podcasts. So that's insane. And we had
Yeah.
5 podcast guests so far in 2024, and we're looking to expand that in 2025. So if you're listening and you know cool people, we're going to start thinking about like themes that we want to work through and what topics we want to bring up and have some experts that know more in those fields to come talk with us and to get their spin on what they see is going on in the world. So we're going to be doing a whole lot more of that here in 2025. And you've got some podcasts coming up out of the state of Nebraska, and we're going to reach out to some of your other contacts in the state of Nebraska. Who knows? Maybe we'll pull in some North Dakota or some Illinois folks and
Yeah.
chat about behavioral health across the Midwest. I think it could be really fun. But
Absolutely. I think we've got so much opportunity to do more interviews and we have such a network and sometimes it's just a lot of coordination, right? And so
yeah,
sometimes I'm kind of going a little too fast sometimes of doing all the stuff I do. And we need to step back because I think there's a lot of value we can bring to everyone who listens if we start thinking about, and so we would love to hear from folks listening, who would you like
Yeah.
to hear from? What type of topics would you like to hear? Because I think we have a real opportunity to engage folks. We've met a lot of people as we traveled across those 12 states. We've made a lot of connections, especially in the behavioral health and healthcare space, and I think there's some good stories to tell that we could all learn from.
I agree. I think it's really cool. And there's more coming up, and some that we've just recently covered that are just amazing, good examples of what's going on in the world that we can chat about. And we've got some others on the horizon. So I'm excited about the guests and who's to come. So we'll be a lot more about that. But the final segment we really want to dive in today is hot topics in the behavioral health field that we expect to see more of in 2025. And I'm going to tell you the first one because I live this one every day. Prison and jail populations are exploding and they have increased needs for behavioral health rehabilitation. There are so many people struggling that end up in that world because they're not getting treatment that they need elsewhere. And so populations are booming, multiple states are building new prisons, other states are trying to figure out how to release additional people, and some states have had to go backwards on that because they released a lot of people and then caused a lot more havoc, and so then had to like reverse course. And it's national. It is national. People struggling about people getting hurt, bad choices. And so it's not just the use of drugs anymore, right? It becomes the sale of them. And now there's more laws on the books if people sell things to folks that kill them, that they come into prison. And again, the population, we just have such a challenge in America with prison population. And so this is a countrywide one. I'll hear much more about that hot topic, but I expect to see it because it's not us, it's everywhere. So Jason, what other topics are you expecting to see in 2025?
Well, directly related to that is state institutions and
Yeah.
institutional care.
Yeah.
Because a lot of times there's a huge crossover population
Yep.
with your prisons and jails,
Yep.
and just the inability to manage folks, or
Mm.
to intervene at an earlier space so it doesn't end up where everyone's in a state institution or jail, or as less people are institutionalized, what happens in your local areas. And so I kind of throw in there with jails and with your prison jail population, those state institutions, because a lot of states have really backed off of that. Some states are moving forward with adding some,
Yeah.
but
Yeah.
it's kind of scattershot what's happening across the country.
Yeah, and in that space, like you said, some have pulled away from those, and then now they're adding them back because they're realizing, and even
Right.
at the federal level, there's some talk about that because they finally put two and two together that maybe people really needed long-term places to be that wasn't prison and jail because those numbers are inverted. If you've ever seen a map about prison numbers, as the numbers of beds went down for institutions, the number of prisoners went up, and so
Right.
it didn't change. We just moved where they were located, and the state and the federal government are still funding all of it, regardless of whether they're in one space or the other. All right, so primary care behavioral health integration. This is a speaking topic we do all the time. But Jason, where do you see that one going this next year?
Yeah, it kind of falls in that bucket of healthcare integration, right? So both
Yeah.
behavioral health in primary care, but also emergency departments. So I kind of bucket all those things together. It's really how are our hospitals and primary care, physician groups, how are they coming together and how are we meeting the behavioral health need as opposed to siloed systems, integrated warm handoffs, all the stuff you would expect of a continuum of care that actually functioned with working clinical pathways. And so I really think that we're going to see a lot more of that and a real drive to move that forward over the next year.
Yeah, another topic we've talked about is community health workers being billable by Medicaid. And community health workers, we have them in many names, many different, but those integrative positions that kind of are navigators,
Mhm.
integrators, peer support,
Coordinators, you
coordinators,
name it.
all those things. But this term is one that's Medicaid billable, is becoming a topic in many of the states we're in. So we're expecting our state and many others to have way more conversations about this one moving forward, I would bet.
Yeah, absolutely. And it's been happening for 20 or 30 years in some of the states we've been in.
Yep.
So it's not new, but I think the philosophy, especially as we look for workforce shortage areas, this is a really great answer, and a way to rethink the way the system is designed. And so I'm really excited about community health workers, especially in rural, remote, and frontier areas, of being able to train up a workforce that we didn't even think existed, non-traditional folks who could be trained in this. I think there's opportunity, but we've got to think differently and able to take advantage of it.
Yep, and we just did a previous episode all about community health workers. So if you're really interested in diving into a more in depth on that one, just go back a couple weeks ago and see exactly what we talked about because it really is an opportunity, like you said, for non-traditional workers and expanding the workforce. And so that could be really cool. Another topic we're expecting to see more about is the emergency department behavioral health issues for
Mhm.
access and support. Again, this is kind of our bread and butter, but it's those small hospitals who get folks with behavioral health stuck in their emergency departments. And, they're critical access. It's not designed for behavioral health to be in the building. They're not supposed to
Mhm.
be billing for them in the building, yet here we are. And almost always across the board, very few hospitals know the resources in their communities. But we have
Yep.
found that there's usually a lot more resources available than people know. And it's about convening and bringing people together so that they know what to do with the person when they get them there, who needs help. And we're seeing more and more people going to their local small hospital in crisis, and we need to help make those dots and connect them. So that's going to be a big conversation. So what else,
Yep.
Jason? What else is on the list?
Well, I mean, I think somebody has to say it, but what's the funding landscape going to look like? What's Medicaid going to
Mhm.
look like? What's federal and state funding look like moving forward? What's going to happen federally in Congress? What's going to happen over the next 2 to 4 years? What's going to happen in our states? Especially the states we're focused on and we're working in. How is that going to impact local communities? How is that going to impact the ability for behavioral health to be delivered in what's largely an underfunded system to start with. And so as we move into times where, we may be contracting a little bit or getting more focused, that may not have positive impacts on what's out there, but we need to think about how do we make it more efficient? How do we streamline it? How do we make the most of what we have? So it doesn't mean there's not opportunity. It just means we've got to think outside of the box. And, it reminds me of some place we're working with right now that hasn't changed what they do for the last 10 years. And so part of me is like, well, maybe we do need some of these external financial pressures to force the system to get more efficient and force us to be better, to be
Mm,
honest. And so, I think there's a lot of ways to look at that. And so I don't think the sky's falling by any means, but I think we need to have some honest conversations, some real candid conversations, right? We do this
yeah.
all the time. We walk in and we say, well, we're going to talk about it openly, and we need to figure out a solution forward.
Yeah, and just for those that aren't aware of this, but the state of Iowa, I think it was the House legislature, just created a specific committee to look at federal funding for the very first time. It's always been just sort of there, it exists, but they haven't really discussed it in the past. And so, especially in things like Medicaid, Medicare, all of it, right? And there's all these federal grants and dollars that come into the state, but everything has been so siloed across the state that those dollars drop in, they get used for something and not necessarily with the big picture in mind. And for the very first time, now there's going to be a committee to try to watch that piece. And I remember being a legislator and you couldn't even really track it because it was extra. And so you kind of had, you'd have your Medicaid budget and it would have the number that you're spending for the state dollars. But then there was all this other money that you pretty much were just like, yeah, but it's in your other pocket. So you didn't really think about it. So states are really starting to think about that. And then I'm wondering, but I don't know. Colorado had a big scandal about how much behavioral health money they spent, and they
Yeah.
just went to an ASO model. Our
Yep.
state's moving to an ASO model. So I'm curious, is that going to help with any of this to keep understanding funding better, or does it make it worse? And I don't know. That's a
I,
hot topic to
I'm
be continued. I don't know.
I'm watching closely because I'm wondering the same thing myself. So we're gonna find out
We're going to
all
learn.
very soon. We're gonna learn it all.
Yeah. And in that, with ASOs, one more piece. What else do we need to look at this next year?
Well, and I've had the conversation in multiple states. I just had the conversation with all of the regional CEOs of another state close to us, and it was around CCBHCs and how do they fit in to our existing systems. And we know that the core services within a CCBHC, it's going to change the way that services are delivered. It's going to change the safety net. And I'm not sure states or Department of Health and Human Services fully understand what that means, or if they're making the changes necessary that they need to be doing legislatively in order to make that happen, in partnership with Medicaid, in partnership with local communities, in partnership with those block grants that historically serve some of that indigent population or backfilled the system of non-covered Medicaid services. And so I think There's going to be a lot of work that needs to be done to make that work successfully. I don't believe in most states enough work has been put in on the front end to design it around the specific state. It's all a cookie cutter approach getting slapped in all across the country. And that's going to be a real struggle in rural and frontier areas. We're already seeing already in rural and frontier areas how this is not working and it has to be modified. It can work, but the systems have to be created in a way that they can be flexible enough to meet the needs of the local community.
Could not have said that better myself. All right, so the self-care policy of the week for the recovering politician. I bought myself a gift for Christmas. There is a thing called the Life Pro vibrating plate that I have used weekly at my gym to be able to help with recovery, stiff muscles, all of that stuff. And I was looking at the research on it and I was like, all the things it says it's supposed to help for, I have all the things. So I was like, what if I just got myself one of these? So back in the day, Black Friday, a while back, really cool deal, couldn't pass it up. So I'm going to have a goal to use this every day for a quarter for 12 weeks. So, and actually track if anything is better or worse, because I need to know. I want to know, does this actually help anything? Because it has some good promises. There's some good research behind it that says it could be a good thing. So I'm trying something new. So from the self-care perspective, what does that mean? I'm trying something different because the things that I was trying weren't working to the level in which I was hoping they would work. So I bought a new tool. The goal is still good health. The goal is still balanced. And so I need to reduce some stress in my life. I can't just get rid of the good job. That would be sometimes fun, or the people. So I need to reduce some stress. So this is supposed to be helping with reducing cortisol. So I found a new tool. So for those out there that don't know my philosophy on things, you look at the goal, but sometimes you have to change the strategy. You can't just get rid of the goal. Goal is for me wellness and good health. And so I'm looking for new strategies. So with this new year, I'm going to track that for my first quarter. That's my habit I'm going to be installing and going to see if it works because I'm pretty excited to see if this is something I can add to my daily routine that makes a difference in my life. So Jason, did you have any new goals for January? You were thinking about new things you were going to implement. Did you ever land on anything you thought for the new year you were
No,
going
I
to?
had to look up. I had to look up what this exercise machine is that you bought.
You
I
got
just Googled
distracted.
it.
You're like, what
I
is
was
this?
distracted. I'm like, what is this thing? I'm like,
What is
well, it
this
looks
thing?
interesting. I know.
It is
So
interesting.
I'm
It's fun.
fascinated by that.
All
Um,
right. Well, it is a lot of
no,
fun.
I'm hanging in there, still running. I'm struggling to motivate myself in the cold. It just is a struggle. But
You.
yeah, I've been on Marketplace. I got to just I haven't got the exercise bike going yet, but I think I'm just going to
Yeah.
pick up a used one and try it for a while. And then I can
Yeah.
get into biking this summer. So,
Yeah. I had that terrible cold cough thing that lasted forever in the fall, and I just could not be out in the cold. That did not help a bit. So anyway, everybody, today we were looking ahead to 2025 and the hot topics that are coming ahead in behavioral health. We want to first be thankful to all of you, our listeners, because we've had thousands of you now, and that's just crazy and beyond our wildest dreams. We're very, very grateful for you. We've been all over the country. We expect to be a lot more places coming up this year. So we'll do a lot more on the location conversations with additional guests of the cool people we meet along the way. And then just talking about, those hot topics. Next time, we're going to dive into a guest speaker that we can't wait to introduce you to. We'll see you then.